Are you a PA or an NP who is looking at a 1099 opportunity and you're not really sure what that entails, and you're not sure if it is a better offer than W 2, the same, or even worse? Or maybe you just don't even know what the difference between 1099 and W 2 really means. Well, that's what we're going to talk about today. Hopefully, I will clear things up for you, answer questions, and help you decide which way you want to head. Hi there, my name is Michelle. I am a PA, and this is the Medicine Couch, where I help PAs and NPs find their fit in medicine and craft a career that they really find fulfilling and satisfying. So, today, let's dive into the 1099 versus W 2 topic. When you say W 2, what it means is that you are working as an employee. You are getting hired by an employer. They are going to be your boss. They're going to tell you what to do, when to do it, how to do it. So that includes things like what days of the week you're working and for what hours, how many patients you're going to see, what patients you're going to see. But when you're 1099, it means that you are an independent contractor. So basically, you are your own boss and you are offering services to a clinic, a hospital, health system, whatever, and you set the terms. So you are telling them what hours you want to work, how many patients a day you want to see, what days of the week you want to work, maybe what patients you want to see. Like if you don't want to see kids under 2 years old, that can be one of your stipulations. Now, that doesn't mean that as a 1099 contractor, you're just going to be able to walk in anywhere and you're going to work exactly the schedule you want and only do the things you want to do. Because while you are the one who is in control of those things, the company doesn't have to hire you. They can hire somebody else who's going to work 1099 who may not have those restrictions. So it's not guaranteed, but that is the base of the definition, is that you really do have control and say over what you do. Some examples would be like if you are somebody who really can see a lot more patients than the average provider, then maybe you come in and you set your hourly wage higher and you say, this is what I want per hour. I will see this many patients and I will do it in X number of hours. Or if you're somebody like me who is a little slower, you may say, look, I will work for this wage, which is probably going to be lower than the other person, but I cap my patient count at 16 or 17 patients a day. And if the company is okay with that and they like your hourly wage and then they hire you, then you are in control of your schedule. So a little bit more flexibility when you're 1099 and you don't often get mired down in company politics, in office politics. You don't have to be on committees and different things. You are just there to do your job, to see patients, and then you go home. So that's the main difference between the two. Now, how does it work out practically? There are two main things we're going to talk about. One is benefits, and the other one is taxes. So you've negotiated this hourly wage, taking into account the fact that when you work 1099, you will not get benefits. You are not eligible by law to get the employer's or the company's health insurance or whatever else they offer. You are your own boss, remember, so you have to supply all that stuff. So when we talk about benefits, you have to think about things like your health insurance. That's a big one. There are ways to get health insurance not through an employer. Oftentimes, if somebody works 1099 and they're married, they will get on their spouse's insurance and get coverage that way. If not, you can buy insurance yourself as an individual. I've done it for years. I use an independent insurance agent. I just go to him, tell him kind of what my needs are, what I'm looking for budget wise, and he comes back with quotes from different companies. You don't have to do that. You can actually go to insurance companies yourself or go to the government website and find health insurance that way. Of course, your premiums are going to be higher 99% of the time, but we'll talk about why that doesn't matter when we talk about taxes. Beyond health insurance, then 401k is another big one that people are concerned about. Oftentimes, working W 2, you'll be eligible to contribute to a 401k plan and have employer matching, so you get that free money coming in. But the advantages of 1099 is that as a self-employed person, you have your own business, you are an independent contractor, you are eligible then for special 401k programs, which means you can contribute more money than you could in a standard W-2 401k program. Plus, you also have more flexibility to shop around and have the components of that 401k program be exactly what you want, often having even lower fees than you would pay through an employer's 401k. So there's some, benefits and flexibility there as well. But then there's things like your vacation, sick days, getting paid for holidays. Obviously, you're not going to get that as 1099, but as 1099 contractor, they can't require you to work certain days. So that could be part of your negotiation when you get hired, that you don't work holidays or you're having so many weeks off a year and up to your discretion when to take them. So it's not like you're not ever going to have time off. That is all going to be figured in to your hourly wage that you present. And at the end, I'll tell you about a calculator that helps you figure out what that hourly wage should be. But then there's other things like malpractice and workman's comp insurance, and can be pretty big things and seem very daunting, especially if you have never gotten those things for yourself. But again, I've done it. They're not that hard and they're not as expensive as you think. And if you are working 1099, but you're doing it through a locums company, you will often be covered by their malpractice and workman's comp insurance. If not, then workman's comp is not that expensive to get. You don't have to get it. If you don't have workman's comp and you get injured, you just file it in your regular health insurance. Now, for malpractice insurance, I never knew what that cost, and I used to think it was, I didn't even know. Like, is it $5,000, $10,000 a year? I thought it was going to be so exorbitant. But in 2018, I actually had to arrange my own health insurance. I was working for a family practice, and sorry, not health insurance, my malpractice insurance. And so I got occurrence malpractice, which means you don't have to have the tail. When you leave, you're going to be covered for anything that happened while you were working during that time span. And it only came out to a little over $1,400 for the entire year. So that's like $115 a month. Not as expensive as I thought, actually very doable. Now, the taxes are probably the other really big thing that people find confusing and don't understand the pros and cons of 1099 when it comes to taxes. So first of all, when you're a W-2 employee, your employer is going to take out all the necessary federal, state, local taxes, whatever. They take that out of your paycheck automatically. Uncle Sam gets their money first thing, and then you get whatever's left. In 1099, it works differently. You will get a paycheck for the total amount of hours you work times whatever your hourly wage is. You get all of that money up front. Then it can be in your bank accounts, gaining interest or using it for what you need to, just to make sure that you can pay your taxes every quarter, because you will have to pay taxes 4 times a year instead of just at the end of the year. Now, if the employer is not taking out taxes, that means that you will have to pay the tax. And people wonder, well, how much is that tax really? When you are working as a W-2 employee, you will have 7.65%, when we're talking federal taxes, taken out of your paycheck. But what you don't see behind the scenes is that your employer is also paying 7.65%. That is their portion of the employment taxes. When you're working 1099, since you are the employer and the employee, you are paying both halves of that. So it is 15.3%. But you can't think about it like, thank God, I'm paying 15.3% more tax than W-2 employee. You're not. You're paying half. You're paying 7.65% more because you were already paying the 7.65% as a W-2. So right now, you may be thinking, well, all of this sounds horrible. I get this hourly wage that may be a little higher, but I've got to pay all of those benefits and I've got to pay 7.65% extra in employment insurance for federal. You're putting out all this money extra and you're like, how does that work out? Well, that is the beauty of 1099, is that you get tax deductions. You are a business owner. Anything that you need to do your job, to keep you informed, to get back and forth to work, all of those things are tax deductible. So let me give you some examples. First of all, let's look at all those benefits. Health insurance premium, 100% deductible. Any of the other insurances you may have had to buy, your licensing, your state license, your certifications, your DEA maintenance, all of that stuff is tax deductible. How about CME? If you go to a conference, all of your travel is tax deductible. So airport parking, flight, Uber rentals when you're there, the conference registration, the hotel, all of that is tax deductible. And just in your regular daily work, your scrubs, white coat, those things are tax deductible. How about equipment you use, like your stethoscope, or if you have your own ophthalmoscope or any other equipment, special equipment that you use, all tax deductible. If you buy UpToDate or Hippocrates or any app, you can deduct those as well because you use them in the course of your business. And oftentimes you're looking those things up on your cell phone. So a portion of your cell phone is tax deductible. Part of your home office could be tax deductible under some circumstances. The mileage to and from the office on work days is deductible. A lot of different tax deductions. So it really does bring down your tax burden. And in the long run, to be honest, most people, if they do it right and do it well, come out ahead working 1099 versus W-2. Now, all of this seems complicated, I'm sure, just hearing it. And you're like, but I can't picture it. I need to do some figuring. How do I figure all that to really compare apples to apples? Well, there are a lot of online calculators that can help you do that. I found one that I really like. It takes into account the state that you work in. You can put in like how many days a week you're going to work and how many hours, how many days off you're going to take throughout the year. You put all that in and then put in what your W-2 salary would be and what you're thinking about charging for your hourly wage as a 1099. You put all that in, hit a button, and then it'll show you what you are taking home, how much net income you're going to get working W-2 at that salary, and how much you'll take home working 1099 at that hourly wage. So it really helps you do that comparison and really puts it in black and white. I'll have a link to that calculator down below. Again, this is just a random calculator I found on the internet that I think is easy to use. Now, if you are considering a position, you're not sure if it's the right move for you in your career, or you're just unhappy with where you're at right now and don't really know how to make changes to make it better where you're at, or what you would want to do or move into, then I would suggest that you think about doing some career coaching. One I would suggest is Casey D'Amato. She has a business called Certified Physician Assistant Counseling. She counsels more than PAs, NPs, physicians. Lots of people go to her for counseling. And her company offers all kinds of things for combating burnout, for helping you figure out what direction you want to head in your career and how to get there, to contract negotiations, to maybe starting your own business or running your own practice. So if that sounds interesting to you, you want to check her business out, I'll have the link down below also in the description box. There's also a discount code there from the Medicine Couch. So if you're going to use services, don't forget, save some money and use the discount code. Well, thank you so much for joining me today. I hope that was helpful, and I hope it filled in some information for you. Thank you so much for joining me today. Take care, stay sane, and I'll see you next time on the Medicine Couch. Bye.